So today we're going to talk about the cheapest COVID-19 therapy in the world. Can you take a wild guess what it is? Voila, it's the sun and what it can do to give you vitamin D. And when I'm talking about the cheapest, I'm talking about the cheapest. It's actually free. It costs you nothing. All you have to do is go out in the sun and get 20 minutes of it. Now, when you evaluate a concept or a theory about something, you want to look at all the factors that align with it. And if there's a lot of things that align with it, chances are it's true. So let's go through the various things that align with this concept that I'm talking about. First thing I want to talk about is a small community in Sweden, in Stockholm. There's a very small group of Somalian immigrants, okay? And they make up less than 1% of the entire population of Stockholm. It's actually 0.84%. Yet, 40% of all the COVID-19 deaths were from this small group. Now, how could that be? Let's take a look. So the first question is, what puts people at risk? You have pre-existing health problems, obesity, diabetes, high blood pressure, cardiovascular disease, COPD, asthma. Well, guess what? The Somalian community did not have many of these pre-existing problems, and they weren't all over the age of 60. So we can rule that out. But what they do have is darker skin. Now, what is about darker skin in vitamin D? Well, the melanin that changes the color of the skin protects against UV. So it's like an ultraviolet sun blocker, which also prevents the absorption of vitamin D. And that also aligns with another concept which occurred in Chicago. 72% of all the deaths from COVID-19 were African American. All right, another point about the Somalians. Their dress code. They usually don't go out and expose their body to the sun. They're pretty much fully covered. Their head is covered. Same thing happens in the Middle East where you have all this sun and a lot of clothing, so you're not going to get a lot of vitamin D. Now, there's two studies, but I'm going to emphasize one that showed a 73% vitamin D deficiency in Somalian women. And last thing, I already mentioned this, there's a low comorbidity. If you take a look at the world based on hemispheres and latitude, you're going to find the great majority of COVID deaths were in the northern hemisphere. And that is related to the distance between where you are and the sun and how much vitamin D you're going to get. Now, there are some exceptions to this, like the Nordic countries, okay? They seem to have a lower risk of COVID-19. How could that be? Well, guess what? They consume a tremendous amount of fatty fish. Okay, so then we have the seasonality. Have you ever noticed certain viruses are seasonal? The flu comes out in the winter. It could be because of the vitamin D deficiency, or it could be these two other things right here, temperature and humidity. There's some really great data on COVID-19 and temperature and humidity. In fact, as the temperature goes up, as in going to the summer, and humidity goes up, you find the virus loads go down. So that's very, very exciting because we're going right into the summer. Vitamin D is a very powerful immune modulator. In other words, it directly regulates a lot of different parts of your immune system, especially the part which puts the fire out of an overreacting immune system. Where there's too much inflammation, that is one of the factors that can kill someone from this virus. Next point I want to bring up is a study from Indonesia. I did a video on this. So basically, they put people in three groups. And I'm talking about people that were infected with COVID-19, actually tested on a blood test. In the first group, 49.7% of the total group had normal levels of vitamin D, okay? And guess what? The mortality rate was only 4%. And the next group they tested had an insufficient amount of vitamin D. So it's kind of like a subclinical amount, or it wasn't completely deficient, but it was a lower amount of vitamin D. And that made up 27.7% of that total group. Check this out. 88% mortality. 88% of that group died from this virus. The group that was deficient made up 23% of the entire group. 99% mortality rate? Why are we not doing studies on vitamin D for prevention as well as treatment for COVID-19? All right, next point is this. Vitamin D from the sun is very anti-inflammatory. It can help reduce the cytokine storm. I'm going to put some references down below. And if you don't know what this is, it's something that actually prevents the exchange of oxygen and CO2 and causes hypoxia and can actually kill someone. Now, one little side story about this is that when I was in practice, I had a patient who literally had a gut like this, okay? He had a huge stomach. And I found that every time he went on a vacation, he went down to Florida, and he would just lay in the sun. And believe it or not, he did not change his diet too much. And he would come back, and his stomach was flat. And I'm going, what the heck happened to you? Well, I think what happened was the vitamin D was an anti-inflammatory. It's an anti-stress hormone, and it really helped a lot of the inflammation that obviously was going on in his abdomen, because it couldn't have been actual fat, because that would take a bit of time to actually get rid of. But I think it was more of an inflammatory state, because I do know that anytime he went through stress, his stomach would just bloat. All right, next thing about vitamin D, it's anti-thrombotic. That means that it helps prevent clots. I don't know if you've seen my video recently on the mechanism between COVID-19 and what it does to your arteries and what it's doing to your vascular system just beyond the lung tissue, the little capillaries there. It's creating clotting, a thrombosis, and that actually is what's killing people. There's always a low vitamin D situation in obese patients, in diabetics, in people that have hypertension, people who have cardiovascular disease, people that have COPD, chronic obstructive pulmonary disease, and people who have asthma. In fact, children who have asthma do very well in the summer and don't do very well in the winter. And the last point is that the older you are, the less vitamin D you have. And that is one of the risk factors. So I hope I've convinced you of the importance of vitamin D in this situation as a preventative therapy, as well as a therapy that should be used during an infection. Unfortunately, it probably won't be studied or even talked about simply because it's the cheapest COVID-19 therapy in the world.
Hey, we're back.
With another amazing recipe.
No grain, no sugar, totally keto. There's no suffering on keto.
Absolutely not.
And it's an immune system builder.
Absolutely. You have to check this out.
I think you should hurry up, watch the recipe, and make it yourself.
It's so easy to be keto.
Is it super easy?
It's super easy. We hope you enjoy making it as much as we are enjoying eating it.